On the COVID front, the BA.2 subvariant of Omicron now the dominant variant in the country, and it's causing some concerns. Here are the latest numbers on new cases across the tri-state. And while the cases are inching up, the numbers overall remain low, and hospitalizations and deaths also remain low. But the subvariant is out there, and it's spreading. Weekend Today, New York's Miles Miller live at the vaccine site at Medgar Evers Community College in Crown Heights. And Miles, getting people vaccinated, of course, remains important, but we're also now talking about a second booster shot.
That's right. That second booster shot now being offered here at Medgar Evers College. This site opened at 8 this morning, and it's a state-run site. The governor telling us just a few days ago that the state will follow the new CDC guidelines. That means people 50 and older, adults who receive the Johnson & Johnson shot, and immunocompromised people 12 years or older can get it if they've had their last booster dose 4 months ago. Now, it comes as COVID cases are slowly starting to rise here in the city. Because of those rises in cases, children between the ages of 2 and 4 years old are being asked, their parents are being asked to continue to put masks on them as they go to schools and daycares across the city. It comes after an appellate court issued a stay Friday night, keeping the so-called toddler mandate in place. The city is appealing after a Staten Island judge issued an injunction against that rule, and the city's health commissioner saying this morning masks are still recommended indoors. Yeah, and as you can see behind me, the site is set up here at Medgar Evers College. The members of the National Guard staffing this center here, and the onus on Medgar Evers College is that they want people in this neighborhood to get vaccinated. The places that really still have that issue about vaccinations include this zip code here in Crown Heights. It's one of the sites that they set up and gave priority by zip code when all of this was first being rolled out last year. It's also where I got my first dose. We're live in Crown Heights. I'm Miles Miller. Today in New York, back to you.
Okay, Miles, thank you. Now, as this new subvariant spreads, naturally, people have a lot of questions and concerns. To help us address some of those worries, we turn now to Dr. Ayman El-Mohandes, who is Dean of the CUNY School of Public Health. Good morning, Doctor, and thank you for joining us.
Good morning, Gus, and thank you for having me.
Well, let's begin with the COVID subvariant, BA.2. We know we've covered that's been spreading. Are we going to see another wave like we saw during the holidays and in the beginning of January?
To be honest with you, unless we take more precautions and are more responsible, it's very likely that we will. There are already 17 counties around the country that have reached a level where the mask mandate by the CDC is enacted, and of those, 3 are in New York. Central New York, we have several counties, Onondaga, Oswego, Cayuga, Cortland, and Madison, where the number of new cases warrant for the governor to mandate mask wearing again. The cases are about 38 per 100,000, which is in central New York, which is almost double for the rest of the state. So we have to be careful. And, you know, people have been using that terminology of endemic, but really endemic means low prevalence, but constantly low prevalence circulating amongst us. I don't believe that we have reached that state, because what we're seeing now are cyclic resurgence every about 3 months with another outbreak, and that is not the pattern that we would call endemic yet. So I would call for caution. Definitely those that are now qualified for a booster should get it. I belong to that age group, and I did get my second booster. For those of us that have received the Johnson & Johnson and a booster, they are also qualified for a second booster. So I would recommend being very careful. And even if the mandates for masks in our county or our neighborhood are not there, that does not mean that we do not practice personal responsibility.
And Doctor, you mentioned the second booster. You say you got it. How does it compare to the first booster? Is it essentially the same shot? And down the line, do you recommend everybody getting it when the CDC guidance, if the CDC guidance changes?
Yeah, I got it. It was actually easier than the last one. Just a little bit of redness and very little pain where the shot was given. But I found it easier than the previous shots. I think eventually we will have to have a vaccine that has a more lasting immunity. The messenger mRNA has been disappointing in that way, meaning that every 6 months it seems like the immunity wanes enough that you need to get another shot. There are other technologies, vaccine technologies. Recombinant protein is being tested in Texas, for example, in Houston, new vaccines. And I hope that new technologies will allow us to at least be protected for a longer period of time, because people are beginning to tire of a shot every 6 months. Does not seem to be very realistic in the long run.
Doctor, I think
so I'm hoping for something better.
Yeah, I think a lot of people are hoping that as well. Doctor, we appreciate your time this morning and for your insight as well. Thank you, and stay safe.
Thank you for having me again.